Welcome to MedSense, where we make medicine make sense. In this video, we are going to be looking at acidosis, which is one of the most highly requested topics from our 100 medical terms. So if you haven't seen the video, our previous video, 100 basic medical terms, do well to watch it, like and subscribe. So we're going to be keeping it as simple as possible. Acidosis is a condition where blood pH drops below 7.35. Now, let's look at the types of acidosis. There are majorly two types of acidosis, which is going to be shown on the screen soon. Metabolic acidosis and respiratory acidosis. Now, this is a diagrammatic representation of what happens as a result of acidosis in the body. Now, let's look at it. From the diagram above, the very first thing that happens in metabolic acidosis now from our diagram is headache. This happens through increased cerebral vasodilation and altered brain metabolism. Now, what do you have note? Acidosis leads to increase in hydrogen ion concentration. Increased hydrogen ion concentration stimulates vasodilation of cerebral blood vessels. This also increases the cerebral blood flow, which eventually leads to increase in intracranial pressure. So that's the mechanism behind how the headache occurs. Now, the next on the list is decreased blood pressure. It's also worthy of note that acidosis directly causes peripheral vasodilation by impairing vascular smooth muscle contraction, leading to a drop in the systemic vascular resistance. Now, a low pH also reduces cardiac contractility. A low pH when we are tending towards acidosis. Now, the next is hyperkalemia from the diagram. Hyperkalemia. In acidosis, hydrogen ions move into the cells to be buffered. To maintain electrical balance of the cell, potassium moves out of the cell into the extracellular space, increasing serum potassium levels, extracellular serum potassium levels. Now, once this happens, this is referred to as hyperkalemia. Now, the next on the list, there are a lot of them, so we'll explain only a few. Muscle twitching. Elevated extracellular potassium, which we just discussed now, depolarizes the muscles and nerve cells, bringing them closer to threshold. This leads to spontaneous muscle contraction. Now I'm going to skip a few of them. Let me talk about one that is very important, which is Kussmaul respiration. Kussmaul respiration. This is a compensatory mechanism of the body. First of all, this is worthy of note. This is a compensatory mechanism of the body which is intended to reduce carbon dioxide. In metabolic acidosis, low blood pressure stimulates carotid and aortic chemoreceptors. It increases the respiratory drive. This is done primarily to cause deep, rapid breathing patterns, which reduces CO2 levels. So we'll just take one from respiratory acidosis, hypoventilation. Now, lack of elimination of CO2 causes hypoventilation. Hypoventilation can invariably lead to respiratory acidosis. Now, let's move. So there are a lot of them on the screen. Do well to go through them at your own time and learn it. Now, the normal range of pH is 7.35 to 7.45, regulated by kidney buffer systems and all that. Metabolic acidosis, this is as a result of accumulation of acid, as a result of the kidney being unable to excrete it, or just general loss of bicarbonate from the body. Now, for the causes of metabolic acidosis, this is a mnemonic to remember it: mud piles. The first one on the list being methanol. Methanol is an industrial solvent which can be seen in windshields and washer fluids. Its metabolism, it is usually broken down by alcohol dehydrogenase into formic acid. Formic acid is a very toxic metabolite in the body, both to the optic nerve, and it also causes metabolic acidosis. Now I'm going to skip a lot of things and move down to the treatment. For the treatment, you give fomepizole or ethanol which is an inhibitor for alcohol dehydrogenase. From our mnemonics, the next on the list is U, which is uranium. Multipliers, remember the mnemonics. Uranium in chronic kidney diseases or acute kidney injury, the kidney fails to excrete acidic metabolites. Examples of such acidic metabolites are uric acid and a whole lot of them. The symptoms include fatigue, nausea, seizures. The treatment, number one, dialysis. Two, correct whatever the electrolyte imbalance may be. Correct the electrolyte imbalance, you do dialysis. We move over to the next one, diabetic ketoacidosis. In type 1 diabetes mellitus, lack of insulin forces cells to use fat for energy, leading to excessive production of ketone bodies, which is acidic to the body. Now let me explain. Under normal circumstances, insulin inhibits lipolysis. Now, when diabetes occurs, diabetes type 1 occurs, the adipose tissues break down the triglycerides into free fatty. The free fatty acids are converted into acetyl-CoA. Now, the acetyl-CoA tends towards ketogenesis, which will eventually lead to the production of ketone bodies, which are acidic. So that is the simple explanation of the diabetic ketoacidosis. Now, the treatment is give IV fluids for dehydration, give IV insulin to stop ketone production. So for this aldehyde, this one is a very easy one. It's an obsolete sedative and anticonvulsant. The metabolism, it's metabolized into acetic acid, causing metabolic acidosis. Treatment, supportive care, very easy. So we move over to the next one, which is iron and isoniazides. Accidental ingestion of iron tablets leads to toxicity. Excess iron disrupts mitochondrial function, leading to lactic acid production and metabolic acidosis. Let me explain. Once the mitochondrial function, which happens to be disrupted, if you can remember, the mitochondria is the powerhouse of the body. Now, once this occurs, there is reduced production of ATP. Once there is reduced production of ATP in the body will tend towards anaerobic metabolism. Now, one of the things that happen as a result of anaerobic metabolism is that lactic acid will be produced in excess. Once this occurs, eventually there will be lactic acidosis, leading to metabolic acidosis. The next on the list being lactic acidosis. I had previously explained part of lactic acidosis. It could occur due to mitochondrial dysfunction, switch to anaerobic metabolism, producing excess lactic acid. Basically what I had said before. Common causes, we have cardiac arrest, hypoxia, metformin toxicity. Metformin, it's a drug used to treat type 1 DM, symptoms, rapid breathing, and the rest of them. Ethylene glycol, which happens to be an antifreeze, could be seen in calculants and all that. If for any reason ingested, it's broken down into glycolic acid, oxalic acid. These are known to cause severe acidosis in the body. The treatment includes famotidine or ethanol, which inhibits its metabolism. Next is salicylate overdose. An example of salicylate is aspirin. Now we are going to be using aspirin as a case study. If aspirin is over ingested, that's if it's abused, taken in large quantities, what it does is very simple. The long and short is that somehow at the tail end it forces the body to rely on anaerobic metabolism. We are looking next at respiratory acidosis. We are going to be looking in-depthly at respiratory acidosis and the possible causes. So respiratory acidosis occurs when the lungs fail to remove enough carbon dioxide, leading to an increased carbonic acid in the body and a decrease in the blood pH. This is caused by hypoventilation or reduced breathing. Practically whatever that inhibits elimination of carbon dioxide from the body. So the causes of respiratory acidosis has a simple mnemonics as well: ABCDE. ABCDE. So it's practically very easy to remember. The first one being airway obstruction. Now let's look at what happens in airway obstruction. This is very self-explanatory. anything that blocks the airway tract, that's the trachea, whatever that blocks it, be it foreign bodies or whatever. The symptoms: shortness of breath. The diagnosis is that there will be high partial pressure of carbon dioxide, CO2, and there will be low pH. The next on the list is brainstem depression. Under brainstem depression, the brainstem is practically responsible for controlling breathing. If it is depressed, respiratory rate decreases, which means that CO2 is not properly exhaled. Example of things that could cause this brainstem depression: we have opioid overdose. Example of opioids: morphine, heroin, fentanyl, stroke, brain injury, name them, as many as you can remember. Symptoms: we have slow breathing, pinpoint pupil, that's in the case of opioid overdose. The treatment: you give an opioid antagonist, naloxone, and the rest of them. The next on the list is chest wall disorders. So under chest wall disorders, any condition that limits chest wall expansion makes it difficult for the lungs to remove CO2. Examples: we have rib fractures, we have pneumothorax, obesity, hypoventilation. Now, these are the things, examples of things that can basically limit, chest wall expansion. Treatment: pain control in the case of wrist and rib fracture, chest tube for pneumothorax. Now, the next is decreased lung function. Example of cases that could lead to decreased lung functions: we have chronic obstructive pulmonary disease, chronic bronchitis, and a whole lot of them. We also have symptoms like shortness of breath. Diagnosis: high partial pressure of CO2, low pH. Treatment: bronchodilators. So the next on the list is excess CO2 production. Conditions that increase CO2 production can overwhelm the body's ability to remove CO2, consider acidosis. That's very easy. Examples of such conditions: we have sepsis, severe infections leading to hypermetabolism. We have hyperthyroidism, increased metabolic rate, and all that. Symptoms include fever, chills, and all that. Um, treatments Treatments include IV fluids and antibiotics, reduced carbohydrate intakes, and that's basically it. So thank you for watching up to this point. Don't forget to like and subscribe, and remember, the subscribe button doesn't bite, so click it. Thank you very much.